I appreciate the opportunity to speak with everyone today, and I probably will not be able to do it near as eloquently as Dr. Traxler has done. As the Chief Clinical Officer of Prisma Health Upstate, I have the fortunate or misfortunate privilege of being the incident commander for the Upstate Incident Command that has dealt with this COVID crisis since the beginning. We actually stood up our incident command well before the first patient appeared in the state because we saw this coming. One of the reasons we did that was to make sure that we could always provide the capacity to the community that the community would need if this became a problem. We have done that successfully up to this point, and we continue to try and maintain that capacity and ability to provide care to all members of the community, and we're moving forward. That said, the community is a partner in this. We absolutely must have the community work with all of our facilities and all of our facilities of our partners at St. Francis. If we do not do that, we could literally overwhelm our ability to take care of patients. Right now we have significant capacity in the system, and we have built that capacity to take care of COVID patients and non-COVID patients. Our desire is to be able to continue to provide normal operations for those that are in need of all medical care. Once again, the caveat to that is communication and cooperation from the community and following guidelines issued by CDC and DHEC. We all know that we're not doing that. I failed at it, the mayor's failed at it, everyone in this room's failed at it. We are a fiercely independent population, and Greenville County is even more so, which is a good thing. But we have to work together as a community and pull together and follow these guidelines and minimize the spread of this disease amongst our members of the community. If you're fortunate enough to have an elderly parent or grandparent, you need to look at it from the perspective of what do we do for them. I make an absolute effort to keep my mother from being exposed to this if possible. And to do that, I need to make sure I'm not exposed to it. So what we are asking here today, because this is a very real problem, is follow the guidelines. Wash your hands, social distance. If you're sick, stay home. Believe what you're being told by the CDC and DHEC. This is not fiction. We are not here trying to tell you something that is not true. We absolutely believe that this is going to be something we can manage through, but we have to do it as partners. The medical facilities, DHEC and CDC, are asking for the population in the Greenville County area to partner with us, and let's work through this together. We need to open up our businesses, we need to open up our community, but we cannot do that the same as business as usual of the past. We just can't go back to doing it the way we used to. For the near future, for the at least intermediate future, we're going to have to be careful. So social distancing, washing your hands, cleaning high-touch surfaces, paying attention to what is around you and the people around you. If you're sick, please stay home. Follow what we are asking you to do, and we will be able to work through this and open up our community at the same time. That said, the other part of this is we still have people with illnesses in the community that are not COVID. It is just as important that they receive the care that they need. And without us working together, our capacity to do that could become limited. Right now, we are more than capable of taking care of the COVID patients and those that have chronic illness. My concern, and the concern of every medical person in this room, is those in the community with chronic illness are not seeking care. It is absolutely imperative that if you have existing chronic disease, you continue to see your physician and continue to get the care that you need. We have measures in place to ensure your safety, and we have the absolute ability to do that. So please, as a community, let's work together. Let's follow the instructions we're receiving from some very, very good organizations in DHEC and CDC. And let's work together and take care of this problem, control the spread of this disease. And I beg the people in the community that have chronic problems, do not be afraid to come in and be taken care of by your physician or the facility of your choice. It is imperative that you do that. We are already seeing not just a spike in COVID that is faster and higher than we have seen, but we're also seeing a significant spike in those with chronic illnesses, because righteously so, you've been afraid to come have care. There is no need to be afraid of that. We will take just as good of care of you as we always have. What all of these medical facilities in our community do is we take care of illness. We plan for these types of problems, and we are prepared to continue to be able to provide you your regular care in addition to taking care of illnesses like flu, COVID, and whatever else comes down the pike. But we do need all of you to work together with us to help make sure we can manage the volume and control the spread of this illness. Thank you.
Hey everyone, good afternoon. Eric Ossman, the Chief of Preparedness and Emergency Physician at Prisma. So just to talk a little bit about our testing, Prisma to date has done around 32,000 tests in the community, both in the hospital, in community settings, and through the drive-up areas that we've set up. And out of those tests, we've had around 9.4% positive. So, and as Dr. James, Dr. Traxler has said, over the last 1 to 2 weeks, we've seen an increase in that positivity rate, which lets us know that the number of cases in the community are increasing. So not only are we doing more tests, but the number of cases are increasing. So I want to make you aware of some of the testing capabilities here. Certainly this week here at the Convention Center, testing is available to the community. It's a great place to drive up and very quickly get tested. 10 a.m. to 2 p.m. We have 4 dates coming up in the upstate. We have one on Saturday, June 13th at Duncan Chapel. We have another one on Thursday, June 18th at the Fountain Inn Elementary. We have an additional one Thursday, June 25th at Alexander Elementary, and the final one Saturday, June 27th at Woodmont Middle School. And we will be scheduling additional dates into July. And so I just want to encourage folks in a few areas. One, as Dr. James said, as a practicing emergency physician working in the emergency department, I can tell you we're seeing a lot of people that delayed care in March and April. People with congestive heart failure, people with diabetes, people with coronary artery disease who did not come in, and now we're seeing some of the consequences of that. So I will say, if you're sick, seek care at either your primary care provider or at the hospital. We've spent a tremendous amount of time making the hospital, the primary care practices safe for people to come in addition to if they have COVID. So we have focused on this from the beginning. Please get care. The second thing I'm going to tell you is get tested. As a practicing emergency physician, I'm encountering a lot of folks that have pretty minor symptoms that have COVID. There are the key things such as cough and fever and shortness of breath, but then there's also a lot of minor things like loss of taste, loss of smell, maybe just muscle aches. We have dedicated a tremendous amount of effort, as has St. Francis, as has the government in Greenville County, to make testing widely available over all aspects of the county. Please get tested if you do not feel well. The other message I just want to reinforce is, the things that we can do to treat the disease in the hospital are pretty impressive. Our specialists have gained a lot of experience over the last couple months taking care of some very, very sick people. But the best thing that can be done for this disease is just to prevent it from happening at all. And I can't do that. Only you can do that by observing the measures that Dr. Traxler has discussed, maintaining good hygiene, and where does this disease spread? It's not spreading in the hospital. It's not spreading in a business environment where people are observing social distancing and wearing masks. It's not spreading in a restaurant where people are observing social distancing and they're observing all their protocols. It's spreading in close groups. So 20 people getting together for a party, very dangerous. People being in close proximity to each other, potentially dangerous. So these are all common sense things, very important to keep in mind. And finally, I'll close. Mayor White asked me to talk a little bit about the personal impact of this. So as a practicing emergency physician, I work in the emergency department here at Greenville Memorial. I worked on Sunday night, and I admitted 2 people, one of them not much older than I am, who were very, very sick with COVID-19. These were people that were air hungry. They were having difficulty breathing. Both of them went to the ICU. So, this is not the flu. This is not a cold. This is a serious disease. People get really, really sick, and we all need to do our part. So, with that, I'll close and hand it over to Dr. Marcus Blackstone, who's the Chief Medical Officer at Bon Secours. Thank you.
Good afternoon. So I'm Dr. Marcus Blackstone, Chief Clinical Officer at Bon Secours St. Francis. So as Dr. James said, our day-to-day job as Chief Clinical Officer make sure that we take care of the COVID-19 patients, but at the same time that we ramp back up our other hospital operations. We've been talking about this for weeks now, and we've asked for everybody to personally be accountable. And so now we're in a situation to where, if you remember, I begged and pleaded with employers to protect their employees with masks, to do the right things. They took a pledge, and if you ride around town, the businesses have done their part. You see tape on the floor, you see plexiglass shields, you see a lot of things that we didn't see before. So it's our responsibility now to do our part as individuals. And I agree, we all have failed at this, but we got to do better, because now we're in a situation, and you're going to hear the same thing from me that you just heard from Dr. James, Dr. Ossman, from the standpoint of our COVID numbers are going back up at about the same time that we ramped up, our elective surgeries. But to Dr. Ossman's point, a lot of the patients that were sitting out waiting, we're just now getting comfortable to come back, that really needed to come back to our facilities. So now that they've come back and those numbers have come up, now we're in another rise, and you can go back to around Memorial Day and count the days, and here we are from that standpoint. But for us to be able to provide care in both of those environments, it makes it difficult. The last thing we want to do is start restricting elective procedures again. From that standpoint. But I'll echo the same thing, is if patients have chronic conditions, we've been doing this for over 3 months now. It's become our new normal. So it's not new. We're used to doing it. We have the same precautions in place around screening, around masking. We still cohort, COVID patients under investigation or positive. We have the capacity to take care of everybody, but we run the risk of overrunning that capacity if we don't get this under control. And so, that's our plea today, is healthcare systems is to work with us, let us do our job and take care of those who truly need the medical care. And, it was interesting before when we talked about this, around the community, we had spots that we would see patients come from. And I agree, the spots are gone. It's widespread now. It's in younger populations. The only other thing that, that I really want to talk about from that standpoint is, we get asked, is this real? And just to be frank, that's really bothersome. From our seat, it's as real as it gets. Nobody's taking numbers out of context. Nobody's making any of this up. It is very real. I mean, we've seen how sick these patients are. We've got one today, or we discharged tomorrow from our hospital, who's been hospitalized for 10 weeks. We got families, and you see the effects on families. You look at the death rate. It is as real as it gets. And we want people to understand that it truly is real, and it's here. And we're at risk of this continuing if we don't do our parts. So with that, I'll stop. I'll turn it over to Jessica Stump from Greenville Emergency Management.